Alarming new data reveals bullying in senior high schools is escalating with devastating consequences, including shattered mental health, collapse in academic performance, and tragically, even student death. Now, in response, school authorities at the Techiman Senior High School and the Africa Health Promotion Organization have launched a student-led war on bullying, on bullying, a peer-to-peer mental health initiative training learners to spot abuse, support victims, and build bullying-free zones. And we'll speak to Crises Johnson Ahoto, who is the executive director of the Africa Health Promotion Organization shortly. But first, here's Solomon Jagba, Bunu East Regional Head of Inspectorate, GES.
We are taking recognition from the effect that bullying caused to most of our students. Some even try to harm themselves because of bullying. So we are thinking that if our learners who have been entrusted to our care to trained, if they live with fear because of bullying, then they cannot excel academically. So we are asking that all our schools will be bullying free and the students can learn with that safe environment to improve their academic excellence.
Now, Executive Director, Africa Health Promotion Organization, Crises Johnson Ahoto, joins me via Zoom to answer how they arrived at this data. Sir, thanks for joining us. How did you arrive at this data?
Many thanks to you, Noella, for the opportunity. And so this data was a landscaping data research that was done by the University of Ghana research department. They came up with this data. And so from the NGO point of view, we in turn triangulated the data on the field, and we came up with this a very detailed issues that are happening in the school. And I'm sure that there are more to it that we can have a conversation. So the first phase of it was the one that was done by the University of Ghana, the landscaping data, which we triangulated across the 12 schools in 6 regions.
Right, and given the tragic outcomes you've observed, including students' death, how would you assess the level of urgency or seriousness school authorities and policymakers are truly attaching to the bullying crisis beyond, just launching symbolic campaigns?
Great. And so if you look at the structure pretty much well, you will come to some realization. The schools authorities are doing a lot more in this regard to attempt to provide some safe space for our students in the various schools. And so you realize that the issues of the original corporal punishment, among others, that are already ongoing through the teacher-student level has been done away with from the GES point of view. What we have to deal with currently now has to do at the student level. And so all the interventions that the GES has always been providing has to do with punishments, more of a reactive situations. And so what we are doing now is a novel where we are using building capacity of students to attempt that they lead this intervention. Let me detail a little bit more into it. So when you look at what is happening now, issues around, we can see some few deaths that happened, issues around major violence issues. They are very threatening structures as the data gave us. Issues around depression, anxiety, self-concept, and many other things that are happening. And so we are introducing this new initiative where we are putting students as the center front because they are the major stakeholders. And apparently they have never led the intervention. And so this new initiative is putting them ahead in the area of prevention. And you see, so that we don't have the case to even talk of having to deal with it in the first place. And so this is exactly what we are doing across 6 regions at the proof of concept stage. And that as we continue to do it and we validate the data, then GES says that, okay, this is a structure and that it can be cascaded to all schools to attempt to limit it in that regard. But I must say that the initiative was first launched with the Director General of the Ghana Education Service, particularly also director for SHEP and guidance and counseling, were all very, when we did the regional structure, the enthusiasm the regional administration attached to the project and the school administration really tells you that bullying is a major issue in the schools, and they are really, really interested in ensuring that they achieve zero tolerance in bullying across our schools.
Great work there. But also walk us through the psychological and social indicators your team is using to measure the impact of the peer-led mental health initiative, and how you will know it's not just creating awareness, but actually changing behavior and saving lives.
Yes, and so we are also most grateful to the Ghana Health Service Ethical Review Committee, who have given us the clearance to do the baseline and endline survey. Baseline has been done already and across all the schools, and we have the data. What we are looking at is that at the end of the day, we want to really see the issues of self-concept. How are they improving in the areas of that? And then the issues of self-reporting that will lead into depression, issues around anger, and that of disruptive behavior. I must tell you that there are really, really detailed issues happening in silence that students are not able to report. And so their peers, they can interact. It's organic, and the issue now are able to transcend beyond the fact that anytime you have any issue, your first point of call initially has been to go to a teacher to report. But now we are having it, student interacting, and then they have their leaders, and then the leaders now have it to the management level. And in that structure, you could see that empowerment becomes greater. And once students are empowered, they are able to really speak for themselves and then essentially take control over their own health. And so we are doing these interventions, looking at these issues that I've mentioned, and want to see greater structures in the area of self-concept, empathy, brotherliness, improving, so that at the end of the day, we will be able to provide a safe space for all to thrive. But come to think of it, in all our structures, right? In all our structures, students who are major stake players in this intervention has always been sidelined, have always been sidelined. And so it is time to give them this major opportunity to really lead the conversation. And when we are in the schools, the enthusiasm, look at the program structure. Per each school, we are developing a minimum of about 30 students who will essentially take control and serve as their peer ambassadors, what we call the peer educators. In many of these schools, that number have been oversubscribed. And then per the school structure, there's always a guidance and counseling coordinator, and as well as the SHEP coordinator. But this intervention is giving opportunity to many other teachers to join in. You see, and so now, if you look at it, we are using the whole society approach. So all hands on deck, and everybody is moving in that direction, and want to see major zero tolerance across our schools in the areas of brotherliness, in the areas of empathy, less in disruptive behaviors, and major issues around suicide ideations. All these are really greater aspects we want to see greater change in. And well,
thank you so much for speaking to us. Mrs. Johnson Ahoto is the Executive Director for the Africa Foundation, and they've been doing some excellent work there.